Hi there, my name's Kate, and I'm going to be talking to you about histamine intolerance, what that is, and why most of us probably don't know what that is. So, to start, histamine is what's known as a signaling chemical, which means the immune system uses it to communicate with other cells. Histamine is typically responsible for inflammatory responses and allergies, and it does so by binding to different receptors. So, first we have H1 receptors, and these cause our typical allergic reaction symptoms, such as difficulty breathing, elevated heart rate, hives, and itchiness. Then we have H2 receptors, and H2 receptors are responsible for the secretion of stomach acid and airway mucus. So, when histamine binds with H2 receptors, there will be extra secretion of stomach acid and mucus will start to build up in the airways. H3 receptors are typically located in the central nervous system, and these help protect and kind of regulate the function of the blood brain barrier, and that in turn protects the brain and helps with the release of neurotransmitters. And then H4 receptors are found in the skeletal system, mostly in bone marrow, and these help to create new blood cells and kind of tell the body what's going on with the blood cells. So, histamine can be involved in most allergy related conditions such as dermatitis, rhinitis, asthma, anaphylaxis. All of those things that can be associated with allergies are caused by histamine. And so, what is a histamine intolerance? A histamine intolerance is when the body has too much histamine. Either it's producing so much that it can't keep up with breaking it down, or it's producing a normal amount, but the body is not producing enough of the proteins that break down histamine to regulate that. And the protein that breaks down histamine is called a DAO. And we can sometimes treat histamine intolerance by using synthetic DAOs and taking them in an oral form, and that can help break down some of that excess histamine. But this has only been effective in certain patients, and histamine intolerance was just recently recognized as a disease, so not many things are known about this. And so we don't really know how to treat this other than by trying the synthetic proteins. And when histamine intolerance can't be treated, it can lead to things such as weight gain, different mental issues. It can lead to dysfunction of a lot of the different organs. And it also can lead to people developing autoimmune disorders, which also cannot be cured. So, histamine intolerance has just kind of been confuzzling scientists recently. And I have a bit of a personal connection to histamine intolerance because I myself have a histamine intolerance. And so I've been kind of dedicated to trying to figure out what has caused my body to misfunction in this way. And I really hope that one day I can be a part of curing histamine intolerance. And here's my work cited. Thank you so much for tuning into this video. And I hope you can go out and learn a little bit and maybe try to contribute to